Carolina Marin of Spain was forced to retire from the badminton semifinals in the Olympics due to a devastating looking knee injury. At the time of the injury, there was a lot of speculation as to the severity of it. However, as of right now, we don't know the specific knee injury that she has suffered. We can, however, make an educated guess depending on the position that her knee went into. And in the case of this injury, it looks like her knee went into that classic dynamic knee valgus position that we see with so many ACL injuries. With today's video, we will of course start off by looking at the injury video. We'll then talk about why that dynamic knee valgus position is so risky for the knee and specifically the ACL. And finally, we'll look at the injury video again and see if there are any other clues that basically can tell us what's going on. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I try to explain them so that they're a little bit easier to understand. I'll also go over the relevant anatomy of those injuries and talk about what that person should expect when coming to rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered an ACL injury, go ahead and comment on your experience in the comment section below. Now we can see here on the injury video that as Marin jumps up and tries to return, she is going to land very awkwardly on that right knee, and that right knee just looks like it's going to cave inwards. Here I have a model of the knee joint, and so the knee is formed by that femur, also known as the thigh bone, that's going to come down and form the top portion of the knee. Then in the lower leg here, we have two long bones. The first one being the tibia, also known as the shin bone, is going to come up and form the bottom portion. Then as we move towards the lateral portion of the model here, we also have a bone known as the fibula. We have four main ligaments that contribute to overall stability of the knee. The first one here is the anterior cruciate ligament, also known as the ACL for short. Then as we flip the model towards the medial or inside portion of the knee here, we have something known as the medial collateral ligament, or the MCL for short. As we flip the model towards the lateral or outside portion here, we have the lateral collateral ligament, also known as the LCL. And finally, on the back here, we have the posterior cruciate ligament, also known as the PCL. And we also have two very important pieces of fibrocartilage, which are located inside the knee joint itself. They are the medial and the lateral meniscus. You can essentially think of these as shock absorbers between the femur and tibia bones. Now let's go over specifically what dynamic knee valgus is. Anytime we see the dynamic knee valgus position, a few things are happening. You're getting eversion, which is going to be the outward rotation of the foot, which is going to cause the lower portion of the leg to externally rotate. Then you're going to get something known as femoral adduction, where that femur is going to be coming inwards. This is also going to be providing some internal rotation at the hip. And as we do this, this is going to allow that knee to cave inwards, which is an extremely risky position for several structures in the knee. Let's start off with the ACL. So we know where the ACL is located, but let's talk about its function. A major function of the ACL is to prevent any sort of anterior or front motion of the tibia away from the femur. Now, what does that look like? That's going to be any sort of anterior slipping of the tibia going this direction. And as I do this on the model here, you can see that that ACL is going to get very taut. And if that motion goes beyond what can be tolerated at that ACL, that's going to lead to an ACL tear. The ACL also provides rotational stability at the knee. So anytime we're going to go in that dynamic knee valgus position where there's going to be a rotational force going through the knee, you can also see that that is going to be stressing that ACL. Other structures that can be stressed in this position, of course, are the MCL, because anytime you're getting a valgus force where the force is going from lateral to medial, that is going to stress and stretch that MCL. It can also lead to a medial meniscus tear. More than one structure can be injured in this. Sometimes all three can be injured in this, and this is called a terrible triad injury. In the case of this injury, however, we don't know specifically whether or not those other structures are involved. However, as of right now, it is very concerning the fact that her knee went into this position and she was unable to finish the match. Another reason why I am concerned for an ACL injury here is this camera angle here. So as we look in very closely onto that tibia, we see that as she lands, it looks like for a moment that tibia is going to slide out forward and then come snap right back in. And this happens a lot when a person's ACL is torn because it's going to prevent that anterior translation for a brief moment. It's going to come forward and then come immediately back. So this is another reason why I am definitely concerned for an ACL injury here. The third reason that I'm concerned for an ACL injury here is the fact that it has to do with her medical history. She suffered an ACL injury on this knee and had ACL reconstruction in the past. So unfortunately, she's had a few factors that it looks like she's definitely at risk for the ACL injury here, but we'll wait for confirmation. Anytime an athlete is suspected to have sustained an ACL tear, there is an on the field or in the clinic test we can do, and the gold standard for that is known as the Lockman's test. And so for that Lockman's test, what we're going to do is we're going to stabilize the person's femur here, and we're going to pull that tibia out coming towards us, giving it that anterior translation, feeling for laxity. If we feel laxity on the injured side, and of course we're going to compare it to the non-injured side, and if we do not feel laxity there, then that makes us believe that the person is dealing with an ACL tear. However, imaging, of course, is going to confirm this. So we expect her to have the MRI, and we hope to have the results of that pretty soon. There, of course, is a grading system for the ACL injuries. They are grades 1, 2, and 3. In a grade 1, this is where you're getting some stretching of that ACL. In a grade 2, you're getting partial tearing. And finally, in a grade 3, this is where you're going to be getting that full rupture of the ACL. Anytime a person is going to suffer at least a grade 2 ACL injury, usually this is accompanied by knee laxity. And this is because they're going to be dealing with either at least some partial tearing and of course a full tear in a grade 3. So she tried to come back and finish the match. She was unable to do that, unfortunately. It looked like she was dealing with a lot of instability in the knee. So I would say as of right now, she's dealing with at least a grade 2 ACL injury, if not a grade 3, because based on what we saw in the injury replay. Grade 3 ACL injuries, because they are full thickness tears, unfortunately require an ACL reconstruction. Given her medical history, once again, she's already had this. So if this is the case, she's going to require having that surgery one more time. And after this, the person is going to be in essentially something known as a drop lock brace, where they're going to have to keep that area immobilized. And maybe there's some weight bearing precautions. It really just depends on the severity of the injury. And it unfortunately is a very long recovery process in physical therapy. It can span anywhere from about 4 to 6 months, sometimes even longer depending on the person. If I happen to hear any updates regarding her case, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So unfortunately, based on the injury video right now, it looks like Carolina Marin suffered a very significant knee injury. We'll await confirmation of that. And of course, if it is confirmed, we'll wish her the best of luck moving forward. Thank you so much for tuning in and watching my video today. If you enjoy this sort of content, I'm gonna go ahead and link another one of my playlists so that you can watch some of the injuries that I've talked about in the past. Thank you again for tuning in, and I'll see you next time.